Are you suffering from a penis that seems shrunken or shriveled at rest, yet hard, firm, or rubbery even when flaccid? Do you occasionally feel tingling, numbness, or discomfort in the shaft, perineum, or pelvic area? If so, you might be experiencing a poorly understood but increasingly recognized condition called hard-flaccid syndrome, HFS. HFS is characterized by a semi-rigid or hard penis in the flaccid state, often described by patients as shrunken but hard, contracted, retracted, or rubbery. Other common symptoms include erectile dysfunction, reduced libido, pelvic floor tightness, perineal or penile pain or burning, sensory changes, numbness, coldness, disconnect, or tingling, and pelvic floor muscle tension or spasm. Beyond the physical and sensory symptoms, HFS can take a heavy toll on mental health and overall well-being, because this condition often involves a cascade of nerve, vascular, muscular and psychological disturbances. When HFS develops, often after a triggering event such as vigorous intercourse, aggressive masturbation, or perineal trauma, minor nerve and vascular damage in the pelvic region may provoke neurovascular changes and sustained pelvic floor muscle contraction. This can lead to altered blood flow, impaired venous return, sensory dysfunction, and a persistent semi-rigid state of the penis even when not aroused. These physical changes do not happen in isolation. The altered sensory input, pain, discomfort, and constant pelvic tension trigger a state of heightened stress and sympathetic, fight or flight, nervous system overactivity. That overdrive can dysregulate autonomic and muscular function, further promoting pelvic floor spasms and impaired neurovascular tone. This dysregulation has profound psychological consequences. Many men with HFS report anxiety, depression, insomnia, lowered libido, and general emotional distress, a psychosocial burden that worsens their sexual and overall health. The overstimulation and dysregulated nervous system can also impair mental clarity. Persistent stress, pain, and body-focused anxiety contribute to mental fog, feelings of confusion, and hindered ability to think or respond logically. Over time, sufferers may experience a steep decrease in confidence, especially as repeated failed sexual attempts or poor performance lead to self-doubt, shame, and fear. In intimate moments, this can further perpetuate sexual dysfunction, decreased confidence and performance anxiety intensify stress, which in turn worsens pelvic tension, neurovascular compromise, and erectile difficulties. It becomes a vicious feedback loop where mind, body, and nervous system reinforce each other, making recovery increasingly difficult. For many, the physical symptoms, the altered genital appearance or sensitivity, the sexual dysfunction, and the emotional burden, that feeling is not purely psychological, it is rooted in real neuromuscular vascular dysregulation, altered sensory processing, and chronic stress responses. HFS is a real syndrome, involving physical, neurological, and psychological dimensions. Understanding this interplay is the first step toward healing, integrating pelvic floor therapy, nervous system downregulation, and psychological care offers a hopeful path forward. If you want a free guide that will give you an idea of the full guide, simply click the link provided in the description or the pinned comment to get instant access.